I'd like to welcome our viewers to today's program of AMII TV. Today we're at a special location, the AMII Studio here in Orange County in our Fullerton location. Fullerton, if you don't know, is just kind of slightly outside of downtown LA. It's kind of like a little suburb. Great area, and today we're having great weather. So we look forward to having you here, kind of a new format. AMII, for those of you that don't know, stands for the Academy of Minimally Invasive Implantology, and we are trying to bring education to our users or some of those that are just interested in not even placing implants yet. And what we're doing is we're creating a unique community of implantologists, and so I really want to welcome you all for listening and watching our program that we have today. The other purpose of this is that you get to see some of our educators and some of the users of our implant system, and what you'll find out is many are just like you. And by using this format, we're able to ask them how they got started with implants, how they integrated implants into their practice, and what kind of success they're having. And I think one of the really valuable points is that the people that we're talking to are real live clinicians, bringing real world experiences. And every time I hear our speakers, I am inspired too when I go back to my practice. So I hope you enjoy that same energy. But again, these are meant to just be informal. So what we encourage you to do is grab a cup of coffee, a glass of water, just kind of sit back and just enjoy the conversation that we're going to have. Today, we are fortunate to have as our guest Dr. Hyun Sook Lim, who practices here in Los Angeles. So she didn't have to travel too far, which is nice. And want to say thank you, Dr. Lim, for taking the time for joining us for the interview today.
Thank you, doctor. The pleasure is mine,
Yeah.
and thank you for inviting me.
Thank you. One of the things that we always like to do is we like to get to know those that we're interviewing. So first thing off, that I like to know is, tell us a little bit about you, where you grew up. You have a very interesting history, some of the things that you like to do.
Well, I born in South Korea, and I grew up in Buenos Aires, which is the capital of Argentina. Buenos Aires was a nice country for us and give opportunity to study and became true our dreams, right? And when I was a little girl, I had this fear going to the dentist, and I was a bad patient, right? Until my parents find the right doctor for me, and from the time I met this doctor, I want to be a dentist.
Yeah.
I really want to be a dentist. I want to be like he is doing, helping children, and as well as my sister. She's a dentist practicing in Buenos Aires, right?
Oh, okay.
And during the time that I was growing up, of course, I wanted to change my career to become like a direct translator. I am very people-oriented person. I wanted to translate, to inform, and be able to be the media to give them information that they need. But eventually, I put myself in the career of dentistry to help people and to get the health through getting a healthy mouth.
Yeah.
Yes.
No, that's great. So you grew up not liking going to the dentist. Then you were actually inspired by your childhood dentist.
That's correct.
And then you were toying around for a little bit of just being a translator because you know Spanish, Korean, and English.
Yes, doctor.
And then you figured out that you really you liked that, but you really enjoy caring for people. So then you kind of went back into focusing on dentistry.
Yes, and medical field.
Yeah. So then, how did that work? So you were in Buenos Aires, and then you went back to Korea?
I finished my career in Buenos Aires together with my sister. We opened our own office, right?
Oh, okay.
And we was working in the community of the people who lives, a population of the Buenos Aires people, and together with Korean community. And then I decided to study more. I really wanted to get my master's degree, to get more trained, more education to provide my patient the best. And then I suggest to go to United States, but at that time my father was very into the Korean community service. So he wanted me to go and study back in my country.
Oh.
And at that time he was my sponsor. He was,
Mhm.
you know, helping me with all the expenses. So at that time, I just listened to him.
Yeah.
And I went to the Hyun Sook University. I did my exam. I did my interview, and I came back to Buenos Aires, not knowing that I was accepted. And then I got a phone call at that time, and I went back to Korea and studied my my master degree in periodontology at Hyun Sook University that I feel very proud of. Yes.
Well, you're all over. You're like an international. You've been internationally educated, which is kind of cool. So, you know, we talked about some of your hobbies that you like to do are what? You're pretty active.
Yes, I can tell, but I'm shy sometimes too.
Yeah. No, you're doing great.
I love to do mission trips. I did several of them more when I was like an associate dentist that I can manage better my time. And I like to paint, actually. I love to paint Korean folkloric painting.
Oh, really?
Even though I grew up in Buenos Aires and I have a lot of influence of that country, I love the art of Korean culture. So I don't know if you ever get a chance to look at those folkloric painting of Korea. They have a lot of colors, right? And it's called Minhwa painting. Minhwa, which is describing the life of the people in the rural place or the everyday living of the population.
So it's actually, so you do art, which probably then helps you with your dental work too, huh?
For the detailed thing that I had to do, yes. I would love to go back to what I like to do, which is that mission trip and painting. But since I opened my office, everything was difficult to get the time, you know, to run a business and to do it everything as you wanted, as dentists want, right?
Yeah, absolutely.
But I would love to have the opportunity to go back to those things that I like to do.
So one of the stories you were telling me before we got started was about the Mexico Guerrero mission trip and how that kind of touched you.
Yes,
Can you tell us a little bit about that? Because that kind of embodies your, you know, your giving back to community and your professional career.
Yes, that's true. I am very blessed that I'm a dentist. Actually, after as I said, I've been doing different mission trips, short and longs, but this one specifically, it was very special for me. Because at that time, I just opened my office. It was not stable yet, but I dropped everything and I went to Guerrero. Guerrero, Mexico was the first place that I was visiting, and this was up to the mountain. Not even the Mexican population, people knew this place. It's Potoichan. It's a very small place. And we go with the idea that we're going to provide, that we're going to give, but actually you come back with your heart fulfilled, and how good it is that you can, you know, help the person and that person, and it's very fulfilling at that time. And remember, I just dropped everything and I left to that place over 5 days, right? And I enjoyed a lot, and that was actually in 2017. Yeah,
not too long ago.
I still remember the peoples, and we took instant photos, and we did like a show day, and we have a small house there with the chairs and also acupuncture, and I had a doctor who went with me too, Dr. Joseph. And we had a wonderful time.
Wow, no, that sounds great. You know, it's funny how sometimes cultures that don't have as much as we do in the States, they're actually very rich cultures. And then, you know, when we go there, they can actually, like you said, they can actually give us a lot to bring back.
Exactly,
so
yes.
It's neat to be able to experience that.
There's no papers to fill out, right? It's just you have to, you just enjoy doing dentistry, and they appreciate it so much. The next time I go, I want to do dentures, able to do dentures in there, because they were so happy that I removed a tooth.
Yeah, yeah,
You
get
know
them
what
out
I-
of pain and
Yes,
discomfort, huh?
exactly.
Yeah.
And I was not even giving a denture, but he
Yeah.
was very, very happy.
Well, maybe you can place some implants. Take a tooth
Yes.
out, put an implant in.
That's
No,
true, that's true.
That's great. I know you've had a really interesting and extensive, rich childhood, especially with your father and your sister and everything. Being able to travel internationally as you went through that, being able to give back to the community like you want to. So tell us a little bit about your practice. You're here in LA?
Yes, yes, doctor. My practice is in the center of East Los Angeles, and our philosophy or goal is very simple. I try to deliver the dentistry, the quality of dentistry in a very caring environment, because they're very afraid to go to the dentist, and my goal is the patient saying that, no, you're not going to be afraid of this one, right? So that's my philosophy and practice. And our office offered general dentistry, from fillings, restorations, inlays, onlays, crowns, to root canals and implant and dentures. So we try to focus in the comprehensive of the delivery of the treatment that they want. Especially, I focus and come out with the customized treatment plan, minimizing being less invasive, and this implant was the perfect for me. Right? And it's a family setting. That we make sure that the patient had a good experience restoring their smile and the health, right?
No, that sounds great. I mean, again, it's kind of the, I guess, the way we wish all dentistry were practiced. Deliver in a caring way, and treatment plan the patients comprehensively, and yet provide the treatment in the most minimally invasive way possible. So it sounds like you've kind of brought everything together. And that's the way that you like to practice.
This one was the one that I was missing, and that's why I feel excited about it. And I said, I'm going to be the one that I want to put the implant in the course, because I was always looking for minimal invasive technique. That's why I went your seminars very often too, doctor.
In the old days, huh?
In the old days, yes, that's true. And that's how I want to practice my dentistry.
So what describe your practice? Is it, you said it's in the center, kind of in the East LA area. Is it a large practice? Do you have a lot of
No, it's a small practice. It took me, even though I have about more than 20 years of being a dentist, I graduated, as I said, in University of Buenos Aires, in the capital of Argentina. I have 20 years of practice. But I went to different countries, right? So my first office, I want to be very family oriented, take the time to know my patients and all that. So my office is a small dental office. It's family oriented. I even see children if my patients' children need a help, right?
Yeah, young and old, huh?
Yes, yes. And I mean, I speak Spanish and write Spanish almost perfectly, because I study, as I was telling you. So that is a very plus for me, because the communication with the patient release them from being too afraid.
And the anxiety
yes,
goes down.
Anxiety goes down. So we do talk a little bit about some other stuff than dentistry, right? And to know my patient fear, my patient goal, expectation, without anybody in the middle translating. So that helped me a lot here, especially in California.
Yeah,
Yes.
no, you've got the perfect mix, with being able to speak Korean and Spanish and English, which is in California our third language. But
all that helped me to understand better the people, the culture, and why that patient is like that. And then knowing their culture, because I know a little bit, I can understand them better and provide them different solution.
Yes.
Yes. Yeah.
No, absolutely. You know, with being in California, also practicing, and we have a lot of Spanish-speaking patients. You're right. And when we can't talk with them directly, there's a little bit of a disconnect, right? And you're trying to make your patients feel as comfortable as possible, but when you're not able to speak to them directly, I think it does make them a little bit more apprehensive. So the fact that you can communicate with them is a great ability to have. And it sounds like, you know, with the caring way you try to deliver your dentistry, that's key. No, it's exciting to hear that. You know,
Thank you, Doctor.
Many of us are trying to get the biggest practice we can have and the busiest practice we can have, and
True,
you know,
but mine is small.
yeah, it's small, which is a good thing. So you had mentioned it before that you like the AMII approach, the minimally invasive implantology approach. So you took a course, the AMII course, and can you give us your thoughts on that?
Yes, I did took the AMII training course. It was about 3 days. 2 days was lectures, very active lectures, not just lecture, it's practicing in the models.
How many implants do you figure you place on the models?
I did, you can do as many you want. You can stay later to do it too, but I did like 2 or 3.
Yeah.
Yes,
Yeah.
2 or 3. And the second day we did the lifting and the MagiCore and all that. And as my experience was going through one day to the second day, I was getting more excited, and I couldn't wait to get the prosthetic portion of the crown.
Yeah.
And I strongly recommend it for anybody who wanna learn something minimally invasive and increase maybe also the rate of succeed, right? For the design, they will see the design, the approach, the protocol is a little different than we used to do. I do take courses and train myself to do implants and hands-on, but this approach is something that you don't want to miss it.
So can I ask you, like the other courses, when did you first start placing your own implants?
I start to place my own implant back in 2015.
Okay.
2015,
About
not that
5 years ago.
long, yeah, 5 years ago, 2015. Very afraid to do it, and I don't want to do it. I prefer to do bridge. But if you look at the patient, the options you can give to the patient, you want to be able to provide them for more options, right? And I used to have a dentist who came to help me to do those things until in 2015 I started to do my own. As a matter of fact, this patient that I did the implant on the 3rd day, he had an implant on the top, number 5, done by me, right? A month and a half ago. So I want him to have the experience of this no sutures, no flap. I had to do suture flap because I do that, right? We just do whatever.
So you can see the bone,
I want to see the bone. I want to touch the bone, and this you have to learn and think all over and learn how to read your approach. And the protocol of Dr. Wang is self-guiding you, right? One drill guides you, the second drill, then the third drill, and all that was wow. And by just looking at the design, is so engineering in there, right?
Yeah.
And this patient was the perfect candidate to tell me the comparison.
Yeah. So what was your patient's final feeling about? So they had the upper tooth number 5, upper right, placed conventionally, flap and everything. And then which tooth was it that you placed?
21st.
21 on
21,
the bottom left.
21,
Okay, so bottom left is placed with the AMII approach, minimally invasive. So what did the patient say? Could he feel the difference?
First of all, he did not get a block. He got a topical anesthesia, right? So that's it. Yes, that's what you're gonna get. And second is of course, I was taking a little longer because I want to triple take care if this gonna work in my
First
patient,
time,
right?
Yeah.
And I take more time, but it was quicker, right? Fast chair side. and no suture.
No sutures.
So
Yeah,
after I
yeah.
finish to drill and do my tightening, and I say, okay, Jose,
Yeah.
this is it,
Yeah, yeah,
right?
yeah, yeah.
And patient just walk, and he says, you already did it,
Yeah.
and I'm no numb all around here.
Yeah,
I
yeah.
just numb here.
Yeah, yeah.
And he could compare the difference,
yeah.
the recovery time.
He,
So
probably thought you forgot to do some steps. It's like,
Yes,
really? Is that what's it going to feel like?
Yes.
And did you have a chance to talk to Jose? So when she says, that's it, Jose, I mean, that was
Yes.
his name. Following that, when you did the follow-up, did he say
Yes,
how
of
it
course.
felt the
Yes,
day after?
I did. I called him right away, and then I called the day after. Tell me everything,
Yeah,
right?
yeah.
So overall, he was very pleased that he could, come here and be my patient again, and not having that much tension on the chair, because there was no much preparation.
Yeah.
There was no a lot of preparation that I do. I do the CGF. I try to put more bone because this is how the angulation I want. So different approach, right, doctor? So he was
Very shocked, huh?
very shocked and happy, and he was very happy.
And I think to give our viewers kind of a backstory, that this facility here in Fullerton, the Orange County Training Facility, is rather new. And you were the first one to actually use our surgical suite in the back and place an implant. So not only were you using a new implant system with a slightly different technique, but you were working in a different operatory, and for everybody else here, it was kind of a new experience. So for you able to do all that and stay so calm, that's a testament to your skill.
I was a little nervous. I was a little nervous. It's not my chair. It's not where's the water. Where's everything?
Where's everything?
Yes,
right?
exactly. But the staff, they do have excellent staff, and the room was nicely set. Right, nicely set. But patient didn't see a lot of instrument. Patient didn't see a table with a lot of instrument and things like that. Right. So
he's comfortable, huh?
it was comfortable. The set was complete. Was enough. So it was fast. So, but.
Well, maybe you can talk to that. So, with different implant systems, and you have experience using different implant systems, do you find that the way the kit is set up with the using the AMII technique, but with the IBSI, the implant system, the way they're all set up in their little kit, that's easy to follow?
You do need to get a training, right? Because this is a protocol that you have to respect. If you respect, you can finish it so fast that you will say, did I miss any step? Because the conventional is not letting you think, it's guiding you. If it's this, go this line, and it's bigger kid, right? In this one, you study as you go, right? And one step will guide you the second one, the second, the third one, and then you finish your implant. And not only that kit, but the instrument. You don't need a full set of surgical, a lot of instruments, as you know, doctor.
And no surgical guide or anything like that?
In my case, was no surgical guide, because you don't, better than surgical guide. It was the first guidance that you place, and you take your CT scan to look at it three-dimensionally, how you're going to correct the angulation and where you are. So that was enough. Yes.
So I think going back to what you were saying before, there's a certain protocol that you follow, and you're kind of evaluating the bone and the surgical site as you go through each step, and then you're taught during the course how to adapt. Like if you get in there and the bone's really hard versus if it's really soft, D1 versus D4. If there's a nerve in the way or a sinus in the way, you're kind of taught how to handle all that. And I think, I just want to make sure I get the name right, is with that Gina Ray Papaya CBCT that's here, like you were saying, you're able to see very well. So what we do is, talking about the multiple drills, we use one drill to just create a kind of initial pilot hole so we can put a little guide pin in there, and then we run a CBCT to be sure we like the angulation and we confirm the depth.
Correct,
like that.
correct.
And then when it comes to the osteotomy, it's just really one drill that fits over that guide pin. So with
Exactly.
one fell swoop, we go to depth, and now we have our osteotomy, which is much smaller in diameter than most other systems, again, being minimally invasive. And then we just kind of clean that hole out, or the osteotomy out, and if the bone is very dense, we thread the bone and then we place the implant, and by doing that, there's really no stress placed on the bone, so we get faster healing, better patient comfort.
Yes.
So, as you were saying, it's a system that's well thought out, and I was talking to another doctor this morning, and I was saying the reason why it was designed this well, and if we talk about the MagiCore implant being a single body implant, as Dr.
Correct.
Wong was always questioning, he said, okay, you know, in your average patient, periodontal disease may show up at 40, 50, maybe 60 years old, and we start to manage that, root plane scaling, and you know, more cleanings. But with implants, often we see an implant goes in, the tissue looks good, you know, maybe 6 months after it was placed, and then 2 or 3 years later, we start to see saucerization and some bone loss and periimplantitis, which is more prevalent today. And so with the MagiCore, the MC system, Dr. Wong designed it so that tissue would just heal up around that magic cuff, and we wouldn't have that periodontal disease, periimplantitis show up anytime soon. So yeah, it's amazing how
Yes,
different the
doctor.
system is.
Yes, yes. That's actually the point that I get very excited about, the bio-seal that you have there, that you don't have to break it again when you're going to take your impression as the conventional one, the bone level implant, right? And this is one body where you're already getting from day number one your bio-seal around those abutments, right? So that was one thing that caught my attention a lot. That's why I want to get involved in this, right? And the fact or the concept of conserving the interface of the bone in that area to be conservative and be delicate in that lead you to successful of the case. And all the drills are designed. The drills are designed to place it very nicely, right? And that, I believe, that can give you higher rate of success on the long term. We are looking for the implant.
Absolutely.
Yes, doctor.
So you know, you have one advantage talking about the language, that you do speak Korean. So Dr. Wong does a great job with his education and all the ideas that he has and all the innovation. He explains why, as you were mentioning, the different parts of the kit were engineered that way.
Yes.
Can you maybe share with us your thoughts on Dr. Wong as like kind of a dentist, prosthodontist, inventor, CEO of the company? Some insights that being able to speak to him directly?
Of course, that was my honor to have him next to me when I was doing my first implant here, and he. As the inventor of this new design, right? Not only the implant, but also the prosthetic part of it. So Dr. Wang, with his background of engineering and being in dentistry long time, right? And coming to United States, trying to teach us, dedicating his time, he is very involved with with each of the dentists coming here in the AMII training center. At the first and second day, he was with us, next to us, every single step, right? Very personalized, train you how to do it. And the experience was very graceful and very good.
Yeah, you know, I know you've done a lot of education in different parts of the world and on different subjects, but I'm always amazed by Dr. Wong and the patience that he has and the way that he's able to explain things so well. And I think one of the interesting things is sometimes, you know, a doctor in the class will ask a question and Dr. Wong will, the patient, say, well, you know, he could answer the questions just fine, but, you know, we don't have those problems with this implant system because he's kind of designed those issues out of the system with either the way he designed the instruments or the surgical technique. And so he's really thought it out. And I think that's one of the things that kind of fascinates me because I know there's a lot of different implant systems out there, and you and I have used many of the different implants. What caught my eye is just the approach and the way that it's just so well engineered and thought out. It's so unique in those ways.
Yes.
Well, I mean, that is, you know, your journey through all this from a young girl, you know, being transplanted to Buenos Aires and running into a dentist when you didn't like going to the dentist, who kind of,
Yes.
you know, made you dream about maybe possibly becoming a dentist, and then all the troubles you went through to learn dentistry and then set up your practice here in LA. I mean, it's very, I think it's very inspirational because you're an overnight success, but it took you 20 years to get here, right? You're doing well today, but you worked hard for a long time. And I think that's one of the things that, you know, a lot of the viewers that are watching this could be young viewers, and, you know, they're trying to figure out how to make it. And maybe one of the last questions I'll ask you is,
Yes.
with all the different services that you offer, do you feel like being able to offer implants in your practice has been valuable? Both from how you serve your patients to the revenue it generates to have a healthy
Definitely,
practice.
doctor. Definitely.
Yeah.
The answer is yes.
Yeah.
And you want to learn implant as a general dentist. You know, as a general dentist, maybe you also have more widely knowledge a little bit about the comprehensive treatment plan for that patient, and able to deliver implant to that patient as a restoration is something that we owe them to the patient. And as a general practice, we can get trained, we can deliver minimally invasive dentistry, minimally invasive implant without giving a better comfort after the implant, right? Short time recovery time as well. I believe that we do, as a general practice, we do need to do implant as a mandatory or part of our daily practice. Yes.
It's a great service. Like you designed your practice to be a family practice, so you take care of young and old. You try to provide all the different services to your patients so they don't have to leave your practice, right?
Sometimes I have to refer
Sometimes
them,
you refer
yes,
out, but there's a lot
or
of
I
things you
bring
do.
some professionals to do it, like sinus lifting.
Yeah.
I had somebody who comes and do those things, or I refer to those masters that I know. But you know, I am into learning this process to be able to do myself.
Yeah, just to give you the heads up, once you take more of the AMII courses, you're going to be doing all your sinus lifts and all your sinus bumps. Yeah. It's probably one of the easiest things and probably one of the most satisfying things. So,
wow.
And you know, we've done other interviews on AMII TV, and we talk about this, that a lot of times, first molars, you know, a lot of times when we take them out, we have very little bone between the alveolar crest and the sinus floor.
Yes.
And it just stumps us. How are we going to place an implant there?
Exactly.
And through the education that you'll get as you take more courses, and from Dr. Wong, you'll see it's so simple. You'll sit there and go, why didn't I do it that way before?
Yes, when I hear that he says the minimally invasive to lift the sinus, the CMC and BEV technique, and he need only 2 millimeter as the initial stability. I say,
It's you know, the way the implant's designed and the technique and everything like that will really make you understand.
I'm very excited to move forward to expand my education to provide to my patient the best service.
Yeah. Well, any other last words?
I just want to thank you to you, doctor, and the AMII Training Institute that give me the opportunity to get approach to this minimal invasive technique that I've been inside my heart in somewhere. I was looking for it, and I got the pleasure to meet Dr. Wang, the inventor, and I want to thank everybody for that.
That's great. No, you know, I want to thank you on behalf of myself and our viewers to have you here, and to share all the insights and everything that you've shared today. I think is going to provide inspiration to others. So, you know, with your heart, the way you want to contribute to others, just know today that you have. I hope that those of you that watch this enjoyed the content. I hope you're able to take a little nugget away, whether it be knowledge or inspiration. And we are really trying to develop this community, and we're trying to make our communication better and better. So please send us any suggestions you have, any suggested topics you'd like to learn more about. And I think today we have in our pockets, we do have our masks. So if you're wondering if we're wearing masks, we are wearing masks, but we figured we'd take it off just so you can see who we are. But I think what's the important part is we need to remember to plan for the future, for our post-COVID future, and implants should be a big part of that. And we hope that we get to see you at an AMII course, that you learn more about the IBS implant system. And we are just all here to help each other out, I think, in the spirit that you were sharing with us before. So on behalf of AMII TV and Dr. Lim and myself, we just wanted to wish the best to all of our viewers. Thank you very much.
Thank you, Dr. Miyasaki.
Great job.
Thank you.
Thank you for watching. If you're placing dental implants or you're interested in learning more about the most advanced minimally invasive implant techniques, please call Mark Garabedian at 949-338-1460 or email him at mark@amii-team.org.